Welcome. You're here because you want to cut through the noise, get straight to what matters.
And that's what we do.
Today, we're doing a deep dive into something maybe a bit under the radar for many dog owners. Canine Lymphangiectasia.
Exactly. It's often unseen, but it can have pretty significant effects. We've got a detailed medical text to guide us.
Right. And our mission is to break it down. What is this thing? How does it show up? And what are the key takeaways from our source?
We'll be digging into the definition, the causes, the signs, how it's diagnosed, and importantly, the treatment options.
Yeah, think of it as getting the core info without needing the medical degree. And I think there might be some surprising connections here.
Definitely. It touches on quite a few body systems.
Okay, let's jump in. So, at its most basic level, what is canine lymphangiectasia?
Well, simply put, it's a problem with the plumbing in the gut. Specifically, the lymphatic system there gets blocked.
Blocked lymphatics in the gut.
Yeah, and this obstruction causes pressure to build up. The main consequence is that the dog starts losing vital proteins into the intestine. It becomes what's called a protein-losing enteropathy.
Losing protein from the gut. That sounds like it could cause trouble elsewhere. Can you maybe paint a picture of what's happening inside? Like an analogy?
Sure. Think of the lymphatic vessels in the intestines. They're called lacteals, like a specialized drainage system. They're meant to absorb fats and proteins after food is digested.
Okay, a drainage system.
Right. Now, in lymphanectasia, that system gets clogged up, like a blocked drain pipe.
Ah, okay. And when that drain gets clogged, what's the immediate result?
Well, the pressure builds behind the blockage. These tiny lacteals stretch, they dilate, and eventually they can actually rupture.
They burst.
Yeah, and when they burst, everything inside them, crucial plasma proteins, immune cells called lymphocytes, and little fat particles called chylomicrons spills out into the intestine.
So instead of being absorbed into the body.
They get lost, dumped into the gut, and passed out.
So the body's essentially leaking out really important stuff.
That's a good way to put it. Now, some proteins might get broken down and partially reabsorbed, but the net loss is significant. This leads to something called panhypoproteinemia.
Panhypoproteinemia, big word.
Yeah. It just means low levels of all the major proteins in the blood, both albumin and globulins.
Okay, low protein in the blood. We know protein's important, but what does that do to the dog? What would an owner see?
Right, the consequences. Low protein, especially low albumin, is a big problem because albumin helps keep fluid inside the blood vessels. It provides oncotic pressure.
Like a sponge effect?
Sort of, yeah. Think of it as helping to hold water within the bloodstream. When albumin levels drop, that pressure decreases, and fluid starts to leak out of the vessels into the surrounding tissues.
Ah, so that causes swelling.
Exactly. It leads to edema, which is that soft swelling you might see, often under the skin, maybe in the legs. It can also cause ascites, that's fluid building up in the abdomen, making the belly look swollen. And even pleural effusion, which is fluid around the lungs, that can make breathing difficult.
Wow. So a gut problem leads to fluid buildup elsewhere because of lost protein. That's a really key connection.
It absolutely is. It shows how interconnected things are.
So besides the swelling or breathing issues, what are the more direct signs related to the gut itself?
Well, the gastrointestinal system is often affected, so diarrhea is pretty common.
What kind of diarrhea?
It's often chronic, meaning it goes on for a while, maybe comes and goes, usually watery or semi-solid, what vets call small bowel diarrhea. But, and this is important,
Yes.
not every dog with lymphangiectasia will have diarrhea. Some don't.
That makes it trickier.
It does. Other signs we might see are, well, weight loss despite a normal appetite sometimes, maybe increased gas or flatulence, vomiting can occur too, and as we mentioned, the difficulty breathing, the dyspnea from fluid around the lungs, the subcutaneous edema, the ascites.
And you mentioned blood clots.
Yes, the source notes an increased risk of thromboembolic disease blood clots forming where they shouldn't. The exact reason isn't fully understood, but it's thought to be linked to the loss of certain proteins that normally help prevent clotting.
So it presents in a lot of different ways.
It really can, which definitely complicates the diagnosis sometimes.
Makes sense. Now, who tends to get this? Is it just random, or are some dogs more likely?
Good question. While technically any dog could develop it, our source says it's most often seen in middle-aged dogs.
Okay. Any particular breeds?
Yes, there are definitely breed predispositions. The ones highlighted are soft-coated Wheaten Terriers, Basenges, Yorkshire Terriers, and a less common breed, the Norwegian Lundehund.
Wheaten Terriers, Yorkies. Those are popular breeds. Does that suggest a genetic link?
It certainly points that way. The text mentions reports of a familial tendency, meaning it runs in families for protein-losing gut issues in these specific breeds.
But they haven't found a specific gene yet.
Not yet, no. The exact genetic cause hasn't been identified for any of them. But the fact that it keeps popping up more often in these breeds strongly suggests there's some underlying genetic vulnerability, maybe in how their lymphatic system develops or functions.
Interesting. What about, say, male versus female dogs? Any difference there?
Only in one breed, apparently. The source mentions a higher rate in female soft-coated Wheaten Terriers.
But not in the others.
Not for the other predisposed breeds, no sex difference is noted. And it's worth repeating, even with these predispositions, lymphangiectasia is still considered an uncommon condition overall.
Uncommon, right, but definitely good for owners of those breeds to be aware of. Okay, let's dig into the why. What actually causes this blockage in the first place? We know the consequences, but what triggers it?
So the causes really fall into two main buckets. There's primary lymphangiectasia, and then there's secondary lymphangiectasia.
Okay, primary first. What's that about?
Primary means the problem is with the lymphatic vessels themselves, likely something the dog was born with, a congenital issue.
Like they didn't develop properly.
Exactly. It could be focal, meaning it just affects the lymphatics in the intestines, or it might be more widespread, diffuse, involving lymphatic abnormalities elsewhere in the body too.
What kind of other abnormalities?
Well, if it's diffuse, you might see it linked with things like chylothorax, that's lymphatic fluid leaking into the chest, or lymphedema, which is swelling in the limbs due to poor lymphatic drainage, chyloabdomen lymphatic fluid in the belly, even issues with the main lymphatic vessel, the thoracic duct. Basically, the whole system might be a bit faulty from the start.
Got it. A fundamental plumbing issue, so to speak.
Yep.
What about the second type, secondary lymphangiectasia?
Secondary means the lymphangiectasia is happening because of another underlying disease or condition. Something else is causing the lymphatic obstruction.
Okay, what kinds of things can do that?
The text highlights a few key ones. Right-sided congestive heart failure is a big one. When the right side of the heart isn't pumping effectively, pressure can back up into the veins and indirectly into the lymphatic system.
Ah, the heart connection.
Yes. Also, constrictive pericarditis, that's when the sac around the heart gets inflamed and stiff, restricting the heart's ability to fill properly, which again increases pressure.
Okay.
Budd-Chiari syndrome, which is a rare condition involving blockage of the veins draining the liver, can also cause backup pressure. And, importantly, certain types of cancer.
Cancer. Which types?
Specifically, lymphosarcoma, a cancer of the lymphatic system itself. The cancer cells can infiltrate the intestinal wall or lymph nodes and physically block the lymphatic flow.
Wow. So heart problems, liver vein issues, cancer. It really shows how a problem elsewhere can manifest as this gut lymphatic issue.
It really does. It makes diagnosis challenging because you have to figure out if it's the primary problem or if something else is driving it.
Right. So let's talk diagnosis. If a vet suspects this, given all the potential signs and causes, how do they actually pin it down?
Yeah, that's key. Differentiating it from other things that cause protein loss is step one. It usually starts with the basic blood work.
CBC, chemistry panel, urinalysis.
Exactly. They're looking for those telltale signs. The panhypoproteinemia, low albumin, and low globulin. Often they'll also see low cholesterol, low calcium, maybe low magnesium, and frequently low numbers of lymphocytes on the CBC.
So those blood results raise a big red flag.
A very big one. But it doesn't automatically mean lymphangiectasia. You have to rule out other major causes of protein loss.
Like what?
Well, are the kidneys losing protein? You check that with a urine protein, that creatinine ratio test. Is the liver failing and not making enough protein? Serum bile acids can help check liver function.
Okay.
Is there bleeding into the gut? An occult fecal blood test might be done, usually after the dog's been on a meat-free diet for a few days to avoid false positives.
Right, makes sense.
There's also a specific fecal test measuring something called alpha-1 protease inhibitor, which directly confirms protein loss from the intestines, though the source says it's not always essential if other signs point strongly to lymphangiectasia.
What about checking for other gut problems that might be happening at the same time?
Definitely. They'll likely do fecal test smears, flotations, and check for parasites. Measuring serum levels of cobalamin, that's vitamin B12, and folate is common. Low levels can indicate problems with absorption in the small intestine.
Does low B12 cause lymphangiectasia?
No, but it often goes along with chronic intestinal diseases, so it's another piece of the puzzle. If they suspect a bacterial issue, like an overgrowth or specific infection, they might do fecal cultures or PCR tests.
So a lot of lab tests to narrow things down. What about looking inside the dog? Imaging,
Yeah.
a fluid analysis.
Yes. If there's fluid buildup, like ascites in the belly or pleural effusion in the chest, analyzing that fluid is really helpful.
What are they looking for in the fluid?
Often in lymphangiectasia, it's what's called a pure transidae, low in cells, low in protein, basically just watery fluid that's leaked out due to low oncotic pressure. But sometimes it can be tylous. That means it looks milky because it contains actual lymphatic fluid, rich in fat. If you see chylous fluid, that's a very strong indicator of lymphatic system involvement.
Okay. And imaging, x-rays, ultrasound.
Both are important. Chest x-rays help check the heart size and shape, look for signs of heart failure, check the lungs for fluid or tumors. Abdominal x-rays can look for obstructions or other obvious issues.
Yeah, and ultrasounds?
Abdominal ultrasound is really valuable. Vets look closely at the intestinal walls. Sometimes they see these bright hyperechoic stripes or streaks in the mucosa, which can suggest dilated lacteals.
Hyperechoic stripes.
Yeah. The source even mentions giving the dog some corn oil orally about an hour before the scan. The idea is that the fat absorption might make these dilated lymphatics stand out more clearly on the ultrasound.
Interesting trick.
And of course, cardiac ultrasound and echocardiogram is crucial to rule out right-sided heart failure if that's suspected as the underlying cause.
So we've got blood, urine, feces, fluid, imaging. Are there more direct ways to get the diagnosis, like biopsies?
Yes, biopsies are often the definitive step. Endoscopy is common.
The camera scope.
Right. They guide a flexible camera down into the stomach and intestines, allowing the vet to see the lining directly and take small tissue samples, the biopsies. Especially important to biopsy the ileum, the last part of the small intestine, if B12 levels are low.
Can they always get what they need with endoscopy?
Not always.
No.
Sometimes a full surgical exploration, a laparotomy, is needed to get larger, full-thickness biopsies of the intestines and maybe nearby lymph nodes. This also allows the surgeon to directly see the surface of the intestines.
What might they see during surgery?
They might see those dilated lymphatics looking like a sort of lacy or web-like network on the intestinal surface, maybe tiny yellow-white spots or even foamy deposits, but there's a caution.
Which is?
Surgery itself can be risky in dogs that are severely hypoproteinemic. Very low protein levels can impair healing. So the benefit needs to be weighed against the risk.
Makes sense. And if heart disease is suspected.
An ECG, electrocardiogram, would be done to assess the heart's electrical activity.
Okay, so once they have those biopsy samples, what seals the deal under the microscope?
The pathologist looks for characteristic changes. The main one is marked dilation of those lacteals within the intestinal villi, the finger-like projections. They look ballooned out.
Ballooned villi.
Yeah. The villi themselves might also be swollen with fluid, edematous, or maybe blunted and shortened. There's often general swelling in the intestinal lining, the mucosa, and usually an accumulation of inflammatory cells, like lymphocytes and plasma cells, in the tissue layers. These microscopic findings really confirm lymphangiectasia.
It sounds like quite the detective work to get that final confirmation. So once it is confirmed, what's the treatment plan? Is there a cure?
Unfortunately, a complete cure for primary lymphangiectasia isn't usually possible. The source stresses that treatment is really focused on managing the condition and its symptoms.
Managing it. Okay. What does that involve?
First off, if the dog is really sick, severely dehydrated, lots of fluid buildup, very low protein, they might need to be hospitalized initially for stabilization. 4V fluids, maybe plasma transfusions to boost protein levels temporarily.
And then long term, what's the core strategy?
Diet. Dietary management is absolutely crucial. It's considered the cornerstone of treatment.
What kind of diet?
The main goal is a diet that is ultra low in fat, but still provides high quality, easily digestible protein.
Ultra low fat. Why is that so important?
Remember how the lymphatics absorb long-chain fats? Feeding those fats increases lymph flow. In a dog with leaky lymphatics, more lymph flow means more protein loss, so you want to minimize that stimulation.
Got it. Cut the fat, reduce the leakage.
Exactly. They generally recommend avoiding high-fiber diets, too. Interestingly, if the dog also has inflammatory bowel disease, which can happen concurrently,
Right.
then sometimes a hypoallergenic diet, one with hydrolyzed proteins that are already broken down, might be beneficial, but it still needs to be fat-restricted.
What about getting enough calories if the fat is so low?
That's where medium-chain triglycerides, MCTs, come in. The source mentions MCT oil or products like Portogen. MCTs are absorbed differently, directly into the blood, bypassing the damaged lymphatics, so they can provide fat calories without worsening the lymph leakage.
Okay, so MCTs can help. Anything else diet-wise?
Yes, fat-soluble vitamins. Because fat absorption is poor, these dogs often become deficient in vitamins A, D, E, and K. So supplementation is usually necessary. In very severe cases, sometimes elemental diets are considered, these are like pre-digested nutrients that require minimal effort from the gut.
A very specific tailored diet seems key. What about surgery? Is that ever used for treatment?
Rarely for the intestinal lymphangiectasia itself. The main exception might be if the lymphangiectasia is secondary to something surgically correctable, like that constrictive pericarditis we mentioned. If you fix the primary cause, the secondary lymphangiectasia might improve, but for primary cases, surgery isn't typically the answer.
Okay, no surgical fix usually. What about medications? Are there drugs that help?
Yes, medications play a role, but mostly in managing inflammation and complications, not directly fixing the lymphatics. Corticosteroids, like prednisone or prednisolone, are often used,
Why steroids?
primarily to reduce inflammation in the gut, especially if there's concurrent IBD. Reducing inflammation can sometimes help decrease protein loss, even if it doesn't fix the underlying lymphatic defect. The source gives typical dosage guidelines.
Are there alternatives to standard steroids?
Yes, sometimes other immunosuppressants like azathioprine or cyclosporine are considered, or a locally acting steroid called budesonide, which might have fewer systemic side effects.
What about those deficiencies like the B12?
Absolutely critical to address. If cobalamin B12 is low, regular injections are needed. The source provides dosing schedules. Same for magnesium. If levels are low, supplementation is required, maybe AV at first. If it's severe, then oral.
Any other common medications?
If there's a suspicion of bacterial overgrowth in the small intestine contributing to the problem, an antibiotic like tylosin might be used for a period. And for managing the fluid buildup.
These sites are pleural effusion.
Right. Diuretics are used. Furosemide is common, sometimes combined with spironolactone, to help pull off that excess fluid and make the dog more comfortable.
So it's really a multi-pronged approach.
Yeah.
Diet, anti-inflammatories, replacing nutrients, managing fluid.
Exactly. A combination approach tailored to the individual dog's needs.
With all that management, what's the typical outcome? What's the prognosis?
The source describes the prognosis as generally guarded.
Guarded, meaning not always great.
Yeah, unfortunately, some dogs just don't respond well to treatment or the disease progresses despite therapy. However, others can achieve remission.
Remission, so periods where they do well.
Yes, symptoms can be controlled, sometimes for months, and the text mentions remissions lasting even over 2 years in some cases, but it's variable. Relapses can happen.
So ongoing monitoring is key.
Absolutely essential. Regular checkups with the vet, monitoring body weight, blood protein levels, watching for any return of swelling or diarrhea. The frequency depends on how severe the case is and how well they respond initially.
Okay. It's clearly a complex and serious condition. As we wrap up, what are the absolute key takeaways for our listeners today?
I'd say 1. Lymphangiectasia is fundamentally a gut lymphatic drainage problem leading to serious protein loss. 2. This protein loss causes widespread issues like swelling and fluid buildup.
Right.
3. It can be primary, something the dog is born with, or secondary to other diseases, especially heart problems or sometimes cancer. 4. Diagnosis is a process of elimination plus specific tests like biopsies.
And 5.
5. Treatment hinges on an ultra-low-fat diet, managing inflammation often with steroids, and addressing specific deficiencies and complications. There's no simple cure. It's about long-term management.
And definitely remembering those predisposed breeds, Wheaten Terriers, Yorkies, Basenjis, Lundahuns. If you own one, it's good information to have in the back of your mind.
Definitely a key point for those owners.
This whole discussion really highlights how intricate the body is, doesn't it? Systems like the lymphatics, which we don't often think about, are just crucial.
Absolutely. And it shows the challenge vets face putting all these pieces together for diagnosis and management. It's often not straightforward.
Makes you appreciate the complexity. And maybe prompts us to think about all those unseen systems working constantly to keep our pets and us healthy.
A good thought. It's a reminder of the delicate balance within the body.
And of course, if any listeners are concerned about their own dog showing potential signs or just want more info, the absolute best resource is always their own veterinarian.
Couldn't agree more. Professional advice is essential.
Thanks for breaking down such a complicated topic for us.
You're welcome. Important information to share.